So we are back. Thank you for joining us. I hope everybody had a good break and feel refreshed and ready to engage. So I invite our audience here in California to come to the microphone if you have any questions. Please remember to introduce yourself and then ask your question. Carlos and Dana are ready to ask. Drew, I was just checking in to see if we have anything online from folks. Okay. So hopefully some of those will come in. I have a couple questions, guys, that I was furiously writing while both of you were speaking, and wanted to get a sense from you about how we actually evaluate the value of sort of the digital world and digital content and creating social media, digital communities. What does that look like? I was really struck this morning about when Robert said, you know, we got this great spike for ALS, but then it really fell off after that. So how do we make it stick? How do we get our issues to remain a really prominent part of the conversation in the digital world?
Do you want to take that on your project specifically?
Sure, maybe,
okay.
But also the work that you've done around this.
Sure.
Sure. So I think that we have to know our audience, and I think that that's been a resounding message throughout the course of the day. And I think one of the perils or pitfalls of social media is that it's such a rapidly evolving scape. And so it's, unless you are repetitive with your messages or address issues that are important to us, population health issues, through multiple angles. What you don't want to do is wear your audience out. And I think being very strategic about how to disseminate those messages and get conversations moving across the digital landscape, the social media landscape, I think there are some ways of going about that effectively, which I think that Carlos is probably much better positioned to talk about that than I am. But certainly knowing, for example, that people are interested in talking about our content and talking about or engaging in the conversations that we're seeking to shape on Facebook as opposed to on our site is critical. And I think it has to do with, in part, the demographic of our audience, whereas we have an 18 to 34 demographic primarily for our site that would be different, for example, if we were the New York Times or a different kind of site. So knowing the audience, repeating the messages, but so as not to tire out your audience, but offering a fresh take, an edgy take on what the messages ought to be.
Yeah, and I'll just add to that I think a big part of it is understanding upfront who the audience really is, who you're really trying to talk to. It's a classic initial conversation where you're going to work on a communications project and you say to someone, tell me your target audiences, but focus on the primary audience. And then 15 minutes later, they have listed every human being with a pulse. And so I think finding the way that finding a way to force people to really articulate who it is they are trying to talk to, what they want them to know, and what they want them to do after the fact, that collection allows you to have an ongoing conversation with them that makes sense. And then the other thing that I'd add to it is we talk a lot about outward communications, what we're saying, what we're pushing, what we're creating, what we're doing. There have to be built-in points along the way where we are proactively listening, where we are saying to the audience, thank you for paying attention to what we do. Thank you for listening to us. Now tell us what we need to do better or differently, what you like, what you don't like. It is one of the great perils of digital and social media, and I think one of the things that makes organizations a little scared is that there is feedback. And I think that we shouldn't put too much stock in the sort of idiosyncratic feedback that you get along the way. But we do need to build in those touch points where we are really listening and saying, we want to do this better, tell us how.
Great. So I see a couple of folks at the mic. I'm going to go here to Sandy. Please introduce yourself, guys.
Okay, Sandy Magnan from ICSI in Minnesota. So I was interested, Dana, you said it, but I expect Carlos would echo it, that you said one of the things social media can do is build relationships, not simply just promote context. And my question is about kind of the balance of building relationships. And I'll give you an example. My son-in-law is looking for another job, and he had corresponded digitally with this professor. And I said to my son-in-law, I said, why don't you ask for an informational interview? That he had never even thought of that. He was doing everything, you know, in the cyberspace. And I said, get in front of this person so you can relate and you can touch base in person. So my question is, how do you know the right balance of building relationships through social media versus in person, or when or not to? I mean, are there some rules of the road about building relationships with social media?
So sorry about that. I think that you build relationships. I mean, we certainly have relationships with writers and journalists and editors, academics, thought leaders who are engaged with us, for example, in shaping conversations. And we all are, we all come together out of a shared interest in what I like to say is elevating the public health conversation. And I think that building relationships, I mean, there are strategies around specifically building relationships with people. So reaching out to them, or, saying, hey, we really like what you're doing. We really like what you're writing. We really like, how, what you're doing for your community. And they reciprocate. The nice thing about relationships, whether they're interpersonal or over social media and occurring in a digital landscape, is that they're reciprocal. So in our social media interactions, it's not just, here's a link to our content, to new content on the 2x2 project. I mean, one of the things we're interested in is and Carlos really, and I very much appreciated his emphasis on this, but curating content. If we're interested in being selective and accurate and looking at what's interesting in the public health landscape, we do every bit as much curation as we do production of content. And so we have relationships that are built on both curation and creation, but they're reciprocal. Some of those relationships have translated into interpersonal relationships, so people that we come across at conferences or meet at meetings like this. Of course, that there are relationships and potential partnerships that can be built on that. But you don't want to be the selfish person like on social media where all you're doing is sort of pushing out your own stuff. It's about reciprocity, and the more reciprocal you are, the greater chance you have at building a sustainable relationship. And I think that those same principles of building interpersonal, in-person relationships apply across a digital landscape. So it's one of the things that we've certainly learned.
Carlos, did you have anything?
No, I mean, I think she hit it on the head. I think you build relationships as the same way as you do in person, that you give and you get. A lot of this is think about, and I said this in my talk, think about how you behave at a conference. Think about how you behave in those interactions, and it is not much different in that space. Don't be overly self-promotional, at least at first. Provide some real value to the people that are following you. Pose questions, but answer them. And I think read, too, on where people have strength. You're not going to pursue a digital relationship with someone who doesn't necessarily have a great presence there. You're going to find the way to meet them in person. But, the other way around, someone who clearly that's the way they operate, you need to find a way to engage with them on that platform. But it's a lot of the same principles that we apply for real interpersonal communication.
And I would just add that I've also heard people say that they use their Twitter accounts as a way to identify and connect, sort of cross-map conference attendance, so that they intentionally take that opportunity to make an in-person meeting when it affords them the opportunity. Yeah. They have the online relationship that then they bolster and strengthen at a conference setting or a meeting setting. Over here.
Thanks. Good afternoon. My name is Tricia Brooks with Novo Nordisk, and I was really excited to hear the 2x2 project really framing itself in population health, because that's really new nomenclature for, I think, the general population. So when we think about these community coalitions and grassroots, but really I think the future is basing that in technology and really using technology to share out these messages. What's the feedback you're getting from the public on sort of embracing that? Because obviously I'm coming from a diabetes lens, and for all of the things people say, we know everything there is to know about diabetes, and you want to say, with all due respect, we know how to identify it, we largely know how to manage it, we largely know how to prevent it, yet all the numbers go in the wrong direction. So I'd love to get a sense what you're hearing from the population about population health management.
Yeah, so we've gotten fantastic feedback, and I think that we've identified a real space, then identified a real need for journalism, blending journalism and science, to effectively translate the public health research. And there's no, we're not a news site, so we're not a news organization, but we are interested in producing, growing and producing high impact journalism around public health issues. And I think it's like any other outlet in which, some of the things, especially when we covered gun violence as a public health issue, for example, I mean, that's a very partisan issue. And so we, got a lot of negative feedback from people who were, gun rights activists and so forth. But I think that is absolutely okay, because what we are interested in doing, like I said, our product really is a conversation, and the way that we're generating and stoking conversation is through blending science and journalism to produce what I think is very intellectually and scientifically grounded pieces that are edgy and provocative at times, and get people talking and thinking about these issues. So I would certainly like to reach a broader audience and have the political spectrum better represented on our site, and there are ways in which we're thinking about doing that, whether it's producing kind of point and counterpoint kinds of pieces, and engaging a variety of perspectives. I think a diversity or heterogeneity in perspective is really necessary to have a rich and textured conversation about population health. So it's certainly a goal that we have, but so far we've gotten fantastic feedback. And we're sort of the little website that could. We're entirely funded by the Department of Epidemiology. We pretty much run this on a shoestring, and we would love to scale up and expand. So certainly looking for opportunities to do that and make this a sustainable effort that's not sensitive to changes in leadership in the school or funding gaps and that kind of thing. But thank you for the question.
So we have a couple other folks. Carlos, I don't know if you had anything you wanted to add on this one. No? So I'm going to go to you, and then I'll come over here to you, David.
Thanks. My name is Michael Manganello, and I have a firm called HCM Strategists, and we do policy and advocacy campaigns around healthcare education. So Tricia kind of asked some of my questions, and you kind of answered some of my other questions, but I'm going to redo them anyway. So I think what Carlos brought up, and you guys were amazing. I thought your presentations were terrific. But one of the things you brought up was branding, which I thought was really interesting, because I think it's really important. And I know the challenge for population health, because someone made fun of social determinants of health, and is anyone ever going to use that? Well, I have to say, we were involved in the most successful advocacy campaign we ran was on embryonic stem cell research. So talk about somatic cell nuclear transfer, mitochondrial DNA, and human embryonic stem cell. It's fixable. So part of my question is about branding and what has to occur. I also think their audiences are. I think the audience for population health is our elected officials and voters. And so that does sort of go to your every human being on the planet, kind of. I was curious about that. And then are there ways, because I am not a new media expert or social media expert, are there metrics along the way to measure success and if you're making the right choices? And that's sort of three-part question, branding and...
Sure. Well, I'll take a little bit on the question of branding. And when you're asking, are you asking about branding of individuals or of organizations or both?
About sort of population health. It's a complex issue, you know, with social determinants of health being part of this, you know, having to solve those problems.
I think one of the key things about it is that it does come back to knowing the audience that you're trying to talk to. I think the other thing is that recognizing that these platforms tell part of the story and that we have to use these platforms to send people to places where they can get the full depth of the story. So even if you think about a website that you're driving people into, at first glance, that website should have a distilled articulation of what the key points are or what the key issues are, but we need to give people those avenues within that site to dig down. So the people in this room, if I told you there's a 150-page white paper on topic X, a lot of you might actually perk up at that. You might say, I want to read that white paper. Other people would say, I don't want to read a 1.5-page white paper.
Executive summary.
So what we need to do is actually think about when we're telling this story, how we're giving people those avenues to drill down further and further and further and further. Because someone out there wants the massive white paper, someone out there wants just the snippet. And I think that the news media is actually one of the really interesting middle grounds in that. And the woman from Michigan was talking about sort of the importance of reading that entire report. Well, she read it so that her readers didn't have to read the whole thing. But she read it enough to understand what sat in the middle that she could make sense for them. So I do think that it is starting with the audience, and then it's thinking through how you build the sites. And I'll just add one last point, is that most organizations, when they build websites, make the mistake of building them to please someone who sits 2 offices over from them.
I never have experienced that.
You know, their largest concern is that their supervisor or someone in their peer group is going to love it and make sense of it and have it be understood. And that is, it is a great challenge, and it imperils websites because you put all the time and energy into building it. The person 2 offices over loves it. And then your target audience says, what is this thing? So force yourself to think about who you want to reach and force yourself to talk in a different way in order to reach them. And I think that applies to social media, to digital media, and to be quite honest, to any media.
Thank you. And I'm going to go to you, David, and then we might have time for one more.
Okay, I think you partly just answered my question, but I mean, I'm sitting here thinking, how do we, this would be very rich, not just your panel, but everything we've heard all day, but how do we kind of build that into our own work in this roundtable? And we've been challenged that we don't exactly know the behaviors we want people to change by Bob Hornick, so we need to narrow that down. But then the audience question, which we're not clear about, but my question is, let's say we did hone down on some small set of behaviors that we thought would be effective if people would change them, and if we made a choice of audiences, be it community youth leaders or media or policy elites or CEOs, would that choice help us navigate the digital and social media environment in terms of what would be most effective?
I mean, I think it absolutely would, because what you'd be doing is you'd be focusing in on what you need to accomplish, but you'd also be generating a proof of concept. If there's any sort of fear within the organization about, well, how do we actually do this? If you bite off at the beginning that we want to talk to everybody about everything, you will fail, it will be weak, it will be watered down, it will take a long time to build the audience. But if you focus in on something specifically and you say, we want to reach this particular demographic slice with this particular message, in order for them to do this particular thing, if you're systematic about doing that, it may not be a game changer at the highest level of your organization, but it is a manageable, tangible, actionable thing that then you take forward and you say, look, if we scale this up and we apply it in a different way, we can get results out of it. So I think, it's sometimes that risk of it has to work for everyone it may not be the best approach. Sometimes the approach says, we're going to use this particular social platform or this particular digital content series to reach this particular audience, and then you have something data-driven to make the case to someone that you should expand it.
Dana, anything to add?
Yeah, just to add to that, I mean, one analog that I like to use is so in fashion, for example, fashion trends are set by tastemakers, and there are very specific strategies that are used to target those tastemakers in order to build a certain taste or a certain fashion. And the same is true for social media. The same is true for public health messaging. You target very particular people that are going to be tastemakers for behavior. It's the same kind of principle. And I think sometimes we can get caught up in some of the language around communication. But I think like any kind of behavior that we want to change or shift norms around or set trends, it's the same set of principles that apply across these different, whether it's fashion or population health. It's the same set of principles that you identify people who can create trends, who can create change, who can create a set of fashions and norms that you can powerfully harness to help you deploy your message in a strategic way.
Thanks. Drew, anything from online?
Yes, there's a question from Kristen Rosengren, and this is in regards to social media and audience targeting. It was mentioned that listening to audience feedback and the need to focus is important. To what degree do you use social network analysis and other analytics tools to define your most relevant audiences online?
For our part, we use it very frequently, but it is nascent in the sense that the platforms that are available to truly understand what is happening on social media are still evolving. And so what I would say is to think that there is one platform that's going to give the perfect analysis of what's going on out in the space, generally, in spite of what software developers might say in a pitch meeting, it's very hard to find one that cracks the code. So we actually use a mix of paid platforms that we feel give us some value, along with some free platforms. And then to be perfectly honest, there's just a lot of elbow grease in terms of understanding what's going on and sort of sinking into Google and looking at what's happening on the platforms themselves that allows you to make adjustments along the way. I also think there's value in certain instances in good old-fashioned research, focus groups, talking to people specifically about how they're using these things, what they're learning, that can be applied. Those are obviously much more expensive than the other options, but in certain cases it makes sense, particularly if there are big advertising campaigns or social marketing efforts that are going to play out that would merit that kind of an investment. But I do think it is a mix of platforms at this point. If someone cracks the code, they're going to make a lot of money, but I don't think anyone has yet cracked that code.
Well, so it's left to me. We're at almost the end of our time together. To sum up everything that we learned in the past hour and a half, hold on to your seats. No, it actually, I think it's been a very robust and rich discussion. Please do continue to share with us your thoughts and ideas. The key takeaways that I had, I thought were both reinforced through Dana's talk and through Carlos's, which is, really assess what you actually are trying to accomplish. And I think Bob's talk this morning really challenged us. What do we want to do? Whether it's a behavior change or a policy change, what is it that we want people to engage on? And then really be thoughtful and intentional about how you use social media to try and engage that particular audience in doing X, Y, or Z. I know that both our panelists and I've certainly experienced this, the power of proactively listening and really letting people challenge ideas and really trying to engage them in the dialogue about how we're going to solve things that are not easy fixes. If they were easy fixes, we would have already done it and been able to check that off on our to-do list. Thinking about how we build influence and understand what will reach those audiences, that's something that Bob also talked about this morning. Understand what we want them to do, and then understand what it is that will get them to do it. I heard that come through today in this panel as well in terms of how we think about the digital world and how we can actually use that. And then I'll end on, really for ourselves, thinking about how we build our brands. Because it is the potential to sort of reach well beyond the people that you come into contact with every day. So how can we be more intentional in engaging the audiences that we want to try and have influence over? But I think one of the things we need to challenge each other on, so I leave this to you as we're ending, is challenge yourself to build your network so that you're listening to people who have a different perspective than you do about how these issues that are so core to really thinking about how we move population health forward in our nation and looking for those intersections, that interconnectedness and that interdependence that I talked about at the beginning, and really push ourselves to hear and listen, because there's a lot of innovation out there. And if we open ourselves up to it, we'll be able to really make progress on this. So please join me in thanking Carlos and Dana. It was a fabulous panel. With that, Sandy, I'm going to turn it back over to you.